My name's Sam Paul. I'm a behavioural scientist. Behavioural science is an evidence-based industry based on social, cognitive, behavioural psychology. So how does this relate to vaccinations? Well, actually, when it comes to vaccinations, we want to increase the levels of motivation of individuals, and we want to reduce the friction points that actually exist in people's environments. So how do we actually do that? Well, I'm going to start with talking about friction points and then moving on to motivation. Defaults are a really important part of the behavioural science toolbox. It's about locking people in advance to a particular appointment. And that may be that you've got data back in 2019 of when someone attended in 2019, or even 2020, or even this year, and using those dates, you can lock them into an appointment in 2022. Send them a notification and then ask them to cancel if it doesn't work. It sets that default, which avoids them just doing status quo, which is doing nothing essentially. Alternatively, you can get them to lock in 2023 from their 2022 appointment. So once they've had their vaccination in 2022, lock them in at that point in time, allows them at 2023 to carry out that behavior with a lot more efficiency. A second key piece to this is what we classify as temporal landmarks. When booking those appointments, orientate the individual to a known date. It helps them to recall and remember when they should attend appointments. So for example, if you book an appointment that is close to Anzac Day, or you book an appointment which is just around the corner from Easter or the start of the AFL season, by actually saying that to individuals, it helps them remember when that appointment is and makes it much easier for them to recall when to attend their appointments. And then finally, the last part is about chunking. So just telling people that there's only a few steps that they need to carry out, that it's really simple to book in an appointment. So for example, it may be you need to book the appointment followed by the attend or find out where to go, followed by the specific time that it actually is. So just making really simple steps actually increases the likelihood that someone's going to attend to or carry out particular behavior. When it comes to motivation, there's three core principles that can help here too. So what we classify as dynamic social norms, which is using the trend of behavior that already exists and talking to others about that trend to guide and encourage behavior. You can talk about more and more people are getting their vaccination rates over the year, or even talk about what someone has recently done. And what we find is amongst those who are a bit ambivalent or haven't necessarily overcome that gap between intention and action, it increases their likelihood that they will carry out that behavior. They're guided by the people that exist around them. Another method as well is to think about what we classify as mental availability. So essentially mental availability is the salience that influenza or flu has within someone's mind. And a key part to this, when we did some research, was we found that there was a really strong connection with the rebound season. 70% of people said once they heard about potential rebound season next year, they were increased in their level of motivation to actually get the influenza vaccination. They see that actually things are changing from this year, and then they need to do something slightly different next year, which is really important given that this year was such a low rate of vaccination. And the third one, and this has changed a lot due to the kind of COVID environment, is we find that there's a heightened level of motivation to do something good for the healthcare system. Individuals care about the healthcare system and they're looking to reduce or diminish the burden that exists. When we tested in the research the impact of influenza on the healthcare system, we found that 70% of individuals said that they were more likely to get influenza vaccinations as a result of knowing that it was going to impact the healthcare system. So a really, really important aspect and motivation to encourage individuals when you're having those conversations with your patients. So those are just a number of tips. Obviously talked about there's a large gap between what people are planning to do and their actions, and we need to help them overcome that gap. But core to this is driving those levels of motivations by talking about the broader healthcare system and the importance of them getting their vaccinations, and also reducing some of those friction points by making it as easy as possible for them and setting up those defaults as well.